The Federal Medical Center, Umuahia, is making a mark in many aspects of medical services. Emmanuel Ugwu writes on the successful commencement of kidney transplants at the healthcare facility, giving hope to people suffering from kidney diseases when in January 2017, the medical director of the Federal Medical Center, FMC, Umuahia, Drive. Abali Chuku visited the University of Toledo, Ohio in the United States of America. He returned home with a big dream. He intended to start kidney transplantation at the federal health facility in God's own state. But not many paid attention to that ambitious pronouncement which he made at a press conference in his office. However, the skeptics did not have to wait for long. By December 2017, FMC Umuahia successfully carried out 2 kidney transplantations, with the beneficiaries now living with new kidneys which they got from donors and transplanted to their bodies to replace their malfunctioning organs. The first patient to receive a new kidney was a 37-year-old businessman, Mr. Umuahia, who had been battling with kidney problem for 4 years. His new kidney was donated by his 58-year-old uncle, who is a civil servant. The harvested kidney was given a new home in Ewell's body after 10 hours of surgical procedure that involved harvesting and transplanting the kidney the night of December 7 and the morning of December 8, 2017. The other patient in the list of pioneer beneficiaries of kidney transplantation at Umuahia is a 68-year-old medical doctor whose own kidney problem was diagnosed 4 months before the surgery. He got a new kidney donated by a security man who is his relative. Making it possible for patients with malfunctioning kidneys to get replacements has stood out. FMC Umuahia is the first medical facility in the southeast and south-south zones of Nigeria to carry out the complex medical procedure. It involves harvesting of a kidney from the donor and transplanting it inside the body of the recipient. It was therefore a huge relief for those suffering from kidney diseases, as remedy has finally come within reach and at affordable cost. This much was expressed by ULE after emerging from the medical procedure of receiving a new kidney. They, FMC Umuahia, provided wonderful opportunity for poor people like us without the means to go abroad for transplantation, he said, adding, "We also thank God for using the medical team to save our lives." Hitherto, any diagnoses that indicated kidney disease was like a death sentence for the patient in this part of the country due to the absence of facilities to handle renal problems. The fear and anxiety associated with kidney disease is more pronounced among the poor who could not afford the high cost of kidney transplant abroad or in any of the few medical facilities that provide the services in Nigeria. Kidney problem is indeed one of the major health conditions that pushes Nigerians to embark on medical tourism in foreign lands, with the attendant drain on the nation's foreign reserve. Chuku's exposure to the medical excellence and global reputation of University of Toledo and kidney transplant inspired him to set in motion the process of replicating it in the southeastern part of Nigeria. Already, the facilities for kidney transplant exist in a few medical institutions, notably St. Nicholas Hospital Lagos in the southwest and Aminu Kano Teaching Hospital, Kano in the north. According to Chuku, the idea of establishing kidney transplant services at FMC Umuahia occurred to him in 2015 when he was honored by the University of Toledo, Ohio, USA, along with others from different countries. This university, Toledo, is globally known for kidney transplantation. After my induction into its Hall of Fame, I was asked what I would want the university do for me and I chose establishing a kidney center, Chuku said. The establishment of the kidney transplant facility at FMC Umuahia did not come in a jiffy. Chuku carefully planned and executed the project. Its journey commenced in 2015 following his induction into the Medical Mission Hall of Fame, University of Toledo Medical Center, renowned globally for its expertise in kidney transplant. Chuku was also designated a distinguished global faculty member of the University of Toledo. After receiving the honors, Chuku made a wish. He asked for assistance to enable him establish a facility to offer kidney transplant services at FMC Umuahia. Consequently, a Memorandum of Understanding (MO) between the University of Toledo and the Federal Medical Center, Umuahia, was signed before he returned to Nigeria after the award ceremony. It did not take long before the MO between the two institutions was activated. In April 2017, Chuku sent a team of medical personnel to Ohio to observe live transplantation of kidney at the Toledo University's Medical Center. They also spent time studying the rudiments of the complex nature of kidney transplant so that when the procedure eventually begins at FMC Umuahia, it will not be strange to them. Interestingly, a Nigerian-American medical practitioner, Dr. Obi Ekwena from the University of Toledo Medical Center, is at the center of bringing kidney transplantation services to FMC Umuahia. He led the team of surgeons that carried out the kidney transplants. The other members of the medical